What would you say is a patient's responsibilities to think about value in how they interact with and use a healthcare system?
Well, okay, that's of course directly starting with a tricky question, right? So I would actually challenge the frame of the question, because it's a bit like, shall we eat soup with a knife or a fork? Is it really a patient's job, if you want, to think about everyone else? You're dealt with a diagnosis that can be disastrous. So from my personal experience, my husband was diagnosed as stage 4 melanoma patient from one day to the next, and we went from planning a third child to preparing for his death. Is that a situation where you want to start worrying about everyone else? Or is this rather today a symptom of a system failure, where if we think about healthcare system, at least of what I call developed healthcare systems, where we have the ambition to provide health and care to everyone on a fair play, is it really happening? Or are we now trying to push the responsibility from that system towards the patient, who in the end is the weakest link, if you want to think about it? And I actually see that, that as a deep problem of our current situation. It's not that I have a solution, unfortunately, because I'm sure that would have been the next question coming. I would rather think that it is a role as a patient advocate to point out where there are the issues for our patients, because we are eventually all going to be patients. People like to say, oh, we are all patients, and I obviously disagree with that, because having a flu is not the same as having a life-threatening disease. So I distinguish between patients and undiagnosed patients. I think the problem with this entire value discussion that we're currently having is that we are putting a person who is in extreme distress in a situation where they have to make trade-offs. And lots of these trade-offs are actually sneaky, nasty restrictions of what I consider as rights of a person. If you think of our societies, health is part of what we consider a citizen's rights. It's not considered a perk that comes with your job or something that you just pay for because you've inherited lots of money. It is something that we consider a part of who we are and the societies we live in. So if you then go to a patient and say, well, is that really worth it? Is your life worth that much? It basically questions that right. And the right to live is actually a human right. So it's not just a citizen's right, it's a human right. So we're going into a very dangerous territory. And I think this is a discussion we should be having much, much more. It's not just about resources allocating to value, but what type of society do we want to live in? What are our values as society? And how do we make our resources go further? And I mean, Brian already alluded to it. We're in changing times, and I think we have to have a much broader discussion than just on value. It's about what type of society do we want to live in, and how do we actually make this possible? Because in the end, our resources are limited.